Welcome to Psychotherapy Education and Training. Today, we're exploring one of the most powerful experiential tools in rational emotive behavior therapy, REBT. And that is called Rational Role Reversal. It's an elegant way to help clients strengthen their disputation skills, deepen self-awareness, and sometimes even reveal beliefs they didn't realize they still hold. In REBT, we teach clients that emotions and behaviors are driven not by events themselves, but more by their beliefs about those events. Rational beliefs are flexible, logical, and helpful, while irrational beliefs are rigid, illogical, and self-defeating. In rational role reversal, the roles are flipped. The therapist plays the client's most irrational self, voicing extreme, rigid, or absolutistic statements. The client becomes their most rational self, and their task is to dispute or counter what the irrational therapist says. It's active, engaging, and often quite revealing. There are three main reasons to use this technique. Skill practice. It helps clients practice disputing irrational thoughts aloud, strengthening their ability to do so internally later. Insight and diagnosis. When a client can't dispute a statement, that often indicates the irrational belief is still strongly held. Or integration. It moves disputation from intellectual understanding into experiential knowing. They don't just know the rational belief, they feel it. Let's look at that process step by step. Step one, identify the irrational belief. For example, I must not fail, or it means I'm worthless. Step two, the therapist plays the irrational voice. Therapists may say something like, you absolutely must succeed. If you don't, it proves you're a failure as a person. Step three, the client plays their rational self. The client might respond, that's not true. My worth doesn't depend on success. I want to do well, but if I fail, it's unfortunate, not catastrophic. I can learn and improve. And step four, the therapist pushes back to strengthen the disputation, the therapist. But if you fail, won't everyone see you as a loser? Doesn't that make you inferior? The client. People might judge me, but that doesn't define me. Their opinions can't determine my worth. And step five, reflect. Afterward, the therapist and the client discuss what felt easy or difficult. If the client hesitated or couldn't refute a statement, it may reveal an underlying belief such as, I need others' approval to feel okay. Let's take an example. The context here is rejection. Irrational voice of the therapist. If someone rejects you, it means you're unlovable and will always be alone. Client's rational response. That's an exaggeration. Rejection does hurt, but it doesn't mean I'm unlovable. One person's opinion doesn't define my whole future. The therapist pressing on, but it keeps happening. Doesn't that prove something's wrong with you? The client, no, it means I may need to learn more about relationships, but it doesn't mean something is wrong with me. I can grow, I can change, and I can keep connecting. If the client gets stuck here, this may be an area to explore. It sounds like part of you believes that rejection equals unworthiness. When the client gets stuck, this may actually have diagnostic value. When clients can't dispute the irrational statement, it's not failure, it's information. It often shows, one, a core belief still held at a deep level, or two, emotional reasoning. The client feels it's true even if they know it's not. This moment becomes a diagnostic opportunity and a target for further disputation, imagery, or homework. You can adapt this exercise. 1, you may have the client write out a dialogue between their rational and irrational selves, or record the role play and review where the disputation weakened, or integrate rational emotive imagery to strengthen the emotional conviction of the rational beliefs. Rational role reversal turns disputation into a living dialogue, one that clients can internalize and continue outside therapy. By helping them argue as their best rational selves, we train both their mind and emotion to respond more flexibly, compassionately, and realistically. If you found this video helpful, don't forget to like and subscribe, and maybe even checking out joining this YouTube channel where you will learn all kinds of new things and applications. I'm Dr. Steve A. Johnson, helping you bring heart and reason together into psychotherapy, education, and training. Have a good day.